Welcome to Healthcare Today. Chondromalacia patella, probably a known entity to a lot of you, especially the young females who have knee pain and visited a doctor. You have heard the name. But what is Chondromalacia patella? So it is nothing but the softening of the cartilage of your kneecap due to abnormal walking, abnormal stress on the kneecap while you are walking, getting up and getting down and bending, sitting down like these positions. Why it happens? So in the females, it mostly happens in the females. In the females, the body shape, the leg shape is different than the male. Their leg is more bent outwards than the male. It is because the female's pelvis is wider than the male, so the knee angle becomes more than the male, and this knee angle causes the patella pull outside when someone bends the knee or trying to sit deep squat. The thigh muscle, the medial portion of thigh muscle, the quadriceps vastus medialis, they helps to keep the patella, pull the patella and keep it in center. If somehow your muscles are not that strong, maybe due to you are not physically that active, or you are chubby one, so your muscles mass are not so high although you are hefty. In these conditions, if your nutrition is also not good, your bone is weak and the cartilage is also weak, soft, then it will get more stress during this activity and it can cause a painful condition. This is the Chondromalacia patella. If we treat it in the very early, then you can get rid of it, you can cure it. And if we ignore, then ultimately the whole layer of cartilage can get worn off, your bone can come out, and that will be very painful conditions. What we can do to prevent this thing to happen? So basically, when someone comes to us with knee pain, early age, young females, we to find out where is the pain. Most commonly and most of the times the clinical examination gives us the more clue and we can diagnose it as a Chondromalacia patella. We usually do not get any investigation done for these patients, those who are coming very early, because we may not find enough positive finding in the x-rays or any other test like MRI. So we try to avoid. Rather, we try to motivate them and convince them to work out with different exercises to strong their muscles, to make their patella movement aligned, so they can off the stress on the patella and the pain get relieved by healing the cartilage. If it doesn't happen and someone ignore it and the condition adverses and the full blown cartilage damage happens, that means the full thickness cartilage get off and the bone get exposed, this condition is very difficult to treat with exercise, nutritional supplements and all other lifestyle modification. Then definitely we have to look for why it has progressed. There are some other factors like malposition of patella, like either sitting the patella down or high, or the angle of the leg that was mentioning early, it is called Q angle. If the angle is very high, then the condition can happen. We try to find out with investigation like x-rays and MRI, what are the predisposition factor, possible factor. If we can find out something, we try to correct them with surgical procedure, and at the same time we try to regenerate the cartilage. Nowadays we have a very good method of regenerating cartilage. There is a bioactive chemical called chondrophil. If we apply the chondrophil on the naked surface of the bone by arthroscopic surgery, they can regenerate a good secondary layer of cartilage that can protect the bony area and that can prevent the pain to happen and make someone pain free. This surgery is not so easy and sometimes we may need to do multiple surgeries of chondrophil to cover all the naked bone and make someone pain free. But whatever it is, if you have pain in the knee, If it is very early stage, be careful, follow the instruction, do the exercise, improve your nutrition, improve your bone health and cartilage health. Definitely you can get rid of this problem. But if you are in the advanced stage, don't worry, still we have the solution. We can make you comfortable and pain free. We care about you.